Okay, hi everyone. Welcome everybody to our webinar today titled How to Grow Your Practice Online. We appreciate your time and taking the effort to join us. My name is Lyra and I'm the Director of Marketing here at Practice Builders. Before we start, I just wanted to quickly cover our webinar guidelines. For webinar quality purposes, we will be putting everyone on mute once the webinar starts. So if you have a question, feel free to type a message into your chat box and we will address the question during the Q&A session. All attendees will receive a copy of the slides of the webinar in addition to a link that will provide a copy of the recorded version. With that being said, I'd like to introduce our presenter, Jonathan Vidal. Jonathan is the Senior Director of Consulting Services and has been with Practice Builders for 6 years now, successfully developing marketing programs for healthcare-related businesses and practices. May I present Jonathan Vidal.
Thank you very much, Lyra, and I want to thank everyone today for joining us. What I truly think is one of the most exciting aspects and areas of marketing a healthcare practice today, and we'll kind of go through that. Lyra was nice enough to discuss my background and history, but the last 6 years here at Practice Builders has been strongly focused on internet and internet marketing initiatives as we pioneered in that area. So, I want to highlight what we're going to learn today. We're going to talk about all the reasons why practices should be marketed online, how to better do that. We're going to look at all the effective elements that are involved. Of course, everybody's very interested in SEO and PPC. And I'll apologize right now if we don't have time for everybody's questions. I'm going to use an actual example as we go through this, and that'll give us an idea of how to better understand these terminologies and things. But sometimes this area does bring up a lot of questions, and in the scope of our webinar tonight, we may not have time for all of that. Then we'll talk a little bit about social media and other trends and online techniques and things. So probably for the group that's listening, I don't even have to highlight why we should, market a practice online today. But obviously this is where a significant portion of your patients are. Probably one of the most effective reasons for marketing online is the fact that patients are now searching you. They're looking for your goods and services when they have the problems. If we use traditional types of marketing, such as running an advertisement or something like that, one of the things we have to hope for is that our target audience will be viewing or reading that medium. And if they're not, we're going to miss the message. But with online targeting, they're actually seeking us out. Obviously, we've done some surveys with patients as well as these Yahoo interactive surveys and information out of media. But it really shows that 60% of patients say they would consider switching their doctor based on having a robust website and the type of information we would recommend. And then about 92% of people are actually contacting. And for those who may have an older patient demographic, someone that's working with 60-year-olds and up, 60-year-olds are the fastest growing segment on the web, and 80-year-olds are meeting on Twitter, so it's very timely today. So let's talk about the benefits of marketing the practice online, and I already alluded to one of those, and that is with a good internet presence that's well optimized both through generic and organic or natural, which we'll talk about and explain, or a PPC strategy, the patients with the problems that you can provide solution for are seeking you. And that's probably the biggest thing. Most importantly, they're out there, well-educated, college-educated consumers that are with good insurance. That's where they are predominantly. It also gives you an opportunity to have patient education tools that can make your practice appear cutting edge. And then also, all of the aspects that the internet brings and the advantages of streamlining communications with your patients, actually doing online appointing, able to be a resource 24/7, and all of the other advantages that are out there. But probably one of the key things to understand is it's not just a website presence. It's really a well-branded website that tells a unique story on you in a consumer digestible way. And that's what we mean by unique practice values or unique practice value, or what you may have heard in older MBA programs as a unique sales position. We don't want to go to a website and see a website that describes anyone generically in your field. So take your name off, put your competitor's name on, and the website works for them. We really haven't told them a unique story or brand. So which practices are better marketed online? Well, the reality is all practices needed to be marketed online. This is a key factor in how patients are evaluating practices today. It really is an extension of your brand. You want to think about, what does your staff do with a phone call to your front desk? either a patient who is ready to appoint or a patient who is seeking information? Do they know to refer all of these patients to your website? It's important in terms of building that brand and telling that story. It's also important to understand that pretty much any patient under the age of 40 to 50 today, certainly very strongly in our 30 and 20-year-olds, are using this as a key way to evaluate their practices. So they may have their physician who is recommending them, or another dentist who's recommending them to go to a dental practice, or they may have a best friend or word of mouth, which is still some of the strongest marketing out there. But in 2010, they'll go out to see what your website looks like to use that as part of their evaluation. And for those of you, again, who have an older patient population and think in 2010 I don't have to be as concerned about website, if you're dealing with significant issues in the older population or the geriatric population, their kids or their grandkids will go out on the website. And I can't tell you the number of times I've actually heard someone say, Mom or Grandma, I wouldn't go to that doctor or dentist. They don't even have a website. So what are some of the essential elements that's important for effective practice websites to have? Well, we already talked about that unique value. So they must answer that question, why you? What's different about you versus your competition? Certainly it should offer all of your services, but really give them a strong consumer digestible message that tells them why you're the right place to go. You got to be either optimized through SEO, search engine optimization, which is the natural or generic way, which we'll talk about, or pay-per-click, to make sure the patients that are searching your services find you. And you must make it simple and easy. Difference between somebody who develops a website to market your practice and somebody in your town who maybe can just develop websites. Every page of your website should have a simple one-click that allows that website to be sent to any family, friends, coworkers, anyone they know. Maybe people in a group, a social group that are blogging together. And you want to be able to send it any way they want to send it, through Facebook or Twitter or YouTube, any way possible. And not having that simple stroke on every page really decreases the visibility of your site. Obviously, simple messaging, easy to understand. This is where it's well understood in consumer digestible messaging that newspapers in this country are written at the 5th grade level, that while it's okay to have a certain amount of medical jargon that's appropriate for describing your practice, that you want to have simple messages that are easy for the consumer to digest, not too much technical jargon, these types of things. Obviously, things that keep them interactive with your website, such as patient education libraries, videos. It's been well shown in studies that patients spend about 10 to 15 seconds on a web page. It's been shown that if you have an interactive video that they come to when they first open your home page, you grab them and they'll spend more time and it increases their interest. Obviously, you want to be able to describe everything that's involved in your practice there. So what are some of the essential elements when we talk about the form or the essence of the website? Sort of what it should look like, what it should feel like. Again, use the appropriate use of white space. You don't want to have too much information so that somebody doesn't know where the eye. There's a saying in marketing called verbal visual unity. Is the person attracted, drawn into the website, given an easy way to navigate, understand the material? When it says maximum of 2 rows of navigation, don't give them more than 2 ways to navigate your website. Maybe bars on one side and blocks across the top, whatever, but don't give them more than multiple than 2 ways. Simple bullet points. Do not expect them to read heavy paragraphs and lots of written material. Get the key elements across. Look at your website today. If I scanned your page in 15 seconds, could you get the essence of your brand and the story you want someone to understand through looking at headlines and bullet points? Obviously, a professional design is important. I like to tell clients that I work with, in 2010, you can probably find someone on every street corner in your town who will create a website for a couple of $1,000s. But will it have a very professional appearance? Every child today knows what you can do with a computer. It's required to go to college to have one. And so Kids in high school today are creating websites that I have some clients that bring to me that they paid a couple of $1,000s for to a graphic designer. Doesn't say quality, doesn't say elegance, doesn't say value. These are important things. You know, this is just an example of a website. This is a client of ours, but giving you the idea of the easy navigation so they can figure out where to go for their services and their information on the practitioners. You know, how do I contact you? Make that simple. And then again, headlines, simple messaging. But you see there's multiple ways here to navigate this so that people can find out very quickly the information that they're looking for. So everyone's asking today, how do I get on the first page? How do I get to the top of the search engine? And I'm actually going to show you an example that will bring this to life and make it live and breathe, because I find a picture's worth 1,000 words, but I'm going to go through a couple of slides and I'm going to simply describe these key areas. So the two terms are SEO, which is search engine optimization, or something called SEM, or paid per click, search engine management. SEO generally means that by the very way that your website was designed, it has value to the search engines. And I will tell you this changes, you know, from day to day, but predominantly in a small healthcare practice, in a regional healthcare environment, if you're optimized for Google, you're doing pretty good. Now that's changing rapidly, but we'll talk about that. You know, you want to make sure that your site is organized for your target audience, not for the search engine. What are your target audiences searching? And you want to have the keywords that they're searching, and we'll talk about that, and I'll show an example of a practice that will get inside the keywords. But, for example, if you happen to be a dental practice, yes, people may go out on the internet and they may search dentist, but they may predominantly be searching their problems. I have a crooked smile. How do I make a straight smile? Rather than searching orthodontist. Or, you know, how about veneers or implants, terms that are out there in the marketplace that people will search for. If you're just optimized for the term dentist, you will not be getting these clients. And then we'll talk about the appropriate use of keywords. We'll talk about the meta tags and all the other things that are involved, like hyperlinks and these types of things that are important. But again, as this comment here at the bottom of this slide says, the key thing is to think about how are your patients searching for you? And quite often it's not in the way you might think. So obviously a lot of search engines out there, a lot of people that are trying to optimize. You know, in 2010, you can go out to, and I haven't done this in a month or so, so this may have changed slightly in terms of its percentages, but you can actually go to marketsharehitlinks.com and it will tell you the volume of traffic. And this is why I tell you, in a regional healthcare practice, if you're optimized for Google, you're doing pretty well. So what's the difference between SEO, or what people call generic, organic, or natural? By the very way the website is designed, it's valuable to these search engines, and pay per click. So again, SEO, this organic, natural method, this refers to everything that appears below the maps on the website, and I'll explain that to you. Other than the design and the cost of properly creating your website, proper meta tags, keywords, headers, all of these things, once the website is set, there's no additional cost for this traffic to come to you, because by its very nature, it is getting up there on the website. And a lot of people will ask me, well, if I can get organically up there and not have to use a pay-per-click, why would I do that? Well, we'll talk about some of those aspects, but when people are really working on the internet, they're looking at total cost of acquisition of clients, whether they come through pay-per-click or SEO. What is my overall cost per client who is calling me? So the pay-per-click method, or what's called PPC, this only happens when someone actually clicks on your site. You're paying this to the search engine, be it Google or Yahoo or these type things, and I'll show you an example that'll make that live and breathe. Meta tags. Meta tags have to do with the code and the source code that's designed behind your website. This is where I like to jokingly say to people, I can have you a website in one night for $24.95 on GoDaddy.com. I'll pick about 6 different settings, 5 different color schemes. You write everything, we'll have it up tomorrow. It will never have the background structure and the quality that Google looks at for this to ever be generically or organically optimized. you would pretty much always have to do a pay-per-click. But some of the things that are understood here is that you want to keep your titles down to 6 to 10 words, your keyword meta tag length between 200 to 500 characters, and it's important that you have different meta tags on every page of your site. We'll talk about state-of-the-art in 2010, that we don't necessarily want our patients or our potential customers or clients to come to our home page all the time. We may want to bring them to those pages that are describing what they're searching. So, what are page titles? These are something that you don't see when you look at your website, or the end user doesn't see, but are in the background that the web designer creates. And you'll see a box up here that shows the keywords or the page titles that we have on our website. This is important. What you'll see on a lot of websites when you print out your site, it'll show these page titles. It'll say practice home, practice services, practice doctors, practice clinicians, these types of things. No one is searching those terms, and this is one of the things that the search engine looks at, the titles. So this should be appropriately populated with all those key search words that people are using. And it's kind of interesting because depending on your specialty, I know we have a number of medical specialists out there. We have some dentists, orthodontists, we have some plastic surgeons. So a plastic surgeon who's involved in breast augmentation could go out and optimize their site backwards and forwards for the term breast augmentation, and it's well understood that young women between the ages of 18 and 32 are actually searching the term boob job. And so be optimized as much as you want for breast augmentation. That's not where your patients and clients are. So what about incoming links? In a regional healthcare practice, these are important. These can help you, but they have to be specific to your specialty in your area. So your medical associations, your study clubs, different peers, referral partners, perhaps leads off vendor sites of services that you do. Any of your educational institutions have a link from the .edu, and any community and health forums. These are all very nice to have. I'm going to do a case study here, and I'm actually choosing a case study that I did for a client. You're not actually going to see the client here because he was not optimized, but it was actually a orthopedic practice in Chicago, Illinois. And so when I first start something like this, I went out and searched orthopedic surgeon. However, I will tell you the majority of patients out there are going to be searching, I have a knee problem. Somebody told me I should have my knee replaced. What about knee replacement? These types of things, and I'll show you all of this. But I first look at the typical term because I know if they're not well optimized for that, the chances are their sites are not optimized for those consumer terms. So what you see at the top is the pay-per-click. You'll notice the top red box. It goes out and covers something that in the top right corner says sponsored links. All the ones down the right side are sponsored links. Those are pay-per-click advertising that you're paying Google or Yahoo or whatever, and in this case Google, every time a patient selects you. Now, in the center of this is the Google Maps. You will only see Google Maps when you're doing a search that has a geographic designator. In this case, I did Chicago, Illinois. And Google brings up a certain number of locations based on their GPS system. One of the things we have noticed that has been changing is the number of reviews seems to be affecting this. So initially it was just geographic location from the center of whatever Google determined was the center of Chicago, Illinois. Now what it's actually looking at is how many of these people are reviewed, and it's changing that. Below the maps, you will find what's called the organic or the SEO method. And of course, Google is interested in driving you to use a pay-per-click strategy because that's where they grow their revenue. But you'll see from this slide, they've actually done eye motion studies on the internet, and it's quite different than how people read books or newspapers. The eye is actually attracted to the upper left corner first, where your primary pay-per-click is, the right side second, and then the middle last. And so that is why they have designed the pay-per-click strategies where they are to get the maximum eye traffic. So I just came down here and you'll see about the fourth one down under this generic or organic. I picked up the first practice there. The ones above it were some of these health grades and city search type things. and it was this orthopedic practice at Rush Presbyterian downtown. You can actually go out on your competitors' sites if they're organically optimized, and anyone that's helping you design a site should do this. Right-click anywhere that there's not a picture, you'll get a window pop up, and you can actually view the client's source code. And so any good web designer should be designing your source code to mimic who's up there. Now, one of the reasons you need someone involved on a go-forward basis helping you with this is Google changes this from time to time on their own schedule with different specialties whenever they feel like it, because of course they'd like to drive you to pay-per-click for the revenue that's involved. So now what I did was I did a little different search. I actually put in hip replace. I didn't even get to month, and it already brought me up solutions. And you'll see that it's a kind of a different setting for this, and who's optimized for hip replacement and who understands this is the way patients are searching. Then I did one for hip doctor. Now this was interesting to me because there's no maps. So the algorithm that Google is using to figure this out, for whatever reason, in their lexicon has decided if I'm searching something like hip doctor, I don't need a map. Intuitively it would make sense you would, but it may just be something that hasn't caught up with their algorithms and these types of things. But I wanted to show you examples of the fact that there are a lot of people that are out there that understand the search terms patients are using and are playing in the pay-per-click strategy to do this in this way. I did one on hip resurfacing. Again, a lot of people playing in this strategy, a very valuable client today for orthopedic surgeons. So what about social media? Social media is very important today. It does a lot of different things. One of it is it creates credibility for your practice. And then they talk about two types of traffic off social media. Primary traffic, which is where a lot of people are actually finding you through Twitter, Facebook, these types of things. And secondary traffic is when you kind of send them back and forth between these different services. So it's important that we try and push our site out there. You can do things with viral videos, but certainly all of our practice today should have a Twitter or a Facebook. In the future, we will be doing a seminar specifically on social media because I could spend an hour or two on that subject alone. But just simply for today, for our attendees, what are some of the simples, what you want to do with a Facebook page and what you don't want to do? Probably the mistake 101 that people make, if you create a Facebook page for your practice, you want to set it up so you have fans, not friends. This is a different use of Facebook, and you want to have everyone that's coming to it be a fan of your practice, not a friend. And obviously encourage all patients that are giving you glowing reviews to go out and write something on Facebook. This is where you do want to add a certain number of pictures about the practice, sort of professional looking. This is where we would not recommend you have friends or the ability for friends to post unrestricted to your website. And remember that this is a key place for engaging in what we call authentic dialogue. And what does that mean in 2010? What that means in 2010 is somebody probably has to interact with your Facebook page daily, certainly 3 times a week. Remember, the internet generation is into instant gratification. And so even if you created a section on your Facebook where they could ask questions, be prepared for the fact that in the internet world, 15 seconds is a long time. So certainly you have to get back to people in 24 hours. You also want to respond to any kind of odd comments or negative comments, and you want to do that quickly on any of these social medias. So what not to do at kind of the high level? When you build a Facebook page, one of the biggest mistakes would be to say, oh, I can do that myself, let's get out there and do it. I don't have a website yet, or I don't have a well-optimized, consumer digestible value website with a unique brand on it. And that really doesn't get you what you want. To just have a Facebook page without a website looks limiting. And also one of the key things is you want to link from your Facebook page to your website. Obviously, it probably goes without saying you don't want to be responding to personal medical questions on Facebook. I have a rare client that has disclaimers and will do that. But again, remember in the internet world, if you're going to have that kind of interaction with your patient clients, unless you have a small patient base, they're expecting sort of that immediate response. Obviously, you know, with all the HIPAA rules, we don't want to present any identifying information on our patients. And again, I said it earlier, but you want them to be fans and not friends. And with anything with the internet, if you're doing PPC and a really well organized optimization, you can get some pretty strong response very fast. But with Facebook, it's kind of more of a growing type of strategy, and it's a longer term type strategy that takes a little longer to have effectivity. So here's the questions to ask yourself when you look at your website today in 2010 and ask, is my website effective? Is the navigation confusing? Is it easy for somebody to understand? And you know, you may want to go ahead and get a friend or a child, someone who's 12, and see if they can navigate easily. Do you have a unique value position, a unique value proposition? Easiest way to evaluate that is, can you pull your name off, put another competitor's name on, and other than maybe your training and your location, everything about the website would work for that competitor. You are not giving them a unique value, or in marketing terms, what we call the YU. Your headlines, does everything elicit action? Does it drive them to get more involved in the website? Does it drive them to make appointments? Does every page have a simple spot for them to contact you? Well displayed phone numbers, and can they request an appointment off every page? Don't get them 6 pages deep in your website and all excited and have them figure out, I got to go back to the home page to request an appointment. Again, you want to have unique content that's keyword friendly, and that means that the keywords that people are searching are kind of written in common conversational format. When possible, is there something that drives them? Do you have offers? Do you have a risk-free offer? You know, is there a no-charge consultation? Or is there an ability to discounted services through your website? Probably one of the most important things is a testimonial page. And I will tell you that everyone needs to be soliciting testimonials from their patients. Word of mouth is still the best marketing there is out there. People are much more interested in what their peers think today than what their doctors think or what advertising thinks. And so anytime we have happy patients in our practices, we should have a survey that at least gives them a place to make a comment, ask them optional place for their name, and then I want to have 2 or 3 pages of patient testimonial. Much more powerful than just having a testimonial with a quote sitting there in air is to have a testimonial that I contribute to Jane V. 2009. Much more powerful than just a plain quote. So we want to be eliciting those and updating them. And again, how is the overall look? Does your website appear like a high school student could do it today? And for a lot of practices who haven't gotten into websites strongly and professionally, I know that you can be very proud of what you've created, but in 2010 you have to understand what you're being compared to. And if it doesn't say value, then you won't be making the impression that you need. So we're going to do our question and answer session now. Lyra has been collecting the questions for me to read. You're not going to actually be able to ask me because you're muted. But before I get to the questions and answers, I just wanted to talk about a couple of real quick slides. First off, we're offering any and all attendees to this website that they can have a free strategic marketing consultation on their website. And that's actually working with a consultant such as myself. Depending on the volume that we get, I may have to bring my colleagues into that. And in addition, we will have our team do a content assessment. We'll look at your traffic quantity and quality. We'll do a performance evaluation and tell you all of these things in terms of how your website's doing today. I also wanted to mention that we're offering a couple of specials here today in terms of anyone that attended some promotional offers. You can receive up to 2 months free SEO with a 12-month contract with us, or you can receive a 15% discount off any website design or development projects, and this site will tell you how to do that. I'm going to leave this slide up while I take the questions and answers here. So, first question. Okay, I guess I've answered this question because somebody was aware that we were offering a free website evaluation and wanted to know what was involved in that. And so I'll go back up so that you can actually see what's involved in that in terms of that free website involvement. Question number 2, what are the components of getting a website running? In other words, what's involved? Well, typically it's going to require you're working with a web designer who understands how to create these things. Again, there are free services you can use out there, but they will not be optimized. And typically, the key thing to remember is where people really get in trouble here is where they go, I need a website, and they run out to design it. And they haven't determined what we call their brand is, or their unique value, or the why you, what we're going to say different about you. And then typically it's involved, you need someone to be involved with regularly updating your organic, natural, or generic optimization. And then somebody may be involved helping you with PPC. Now, if you're not a practice such as a high subspecialty physician practice who does a lot of direct-to-consumer marketing, but more you're on a professional referral and word of mouth, you may never need to do a pay-per-click strategy. It really depends what your competition is doing out there and the cost of these things. Content for my site. Oh, does practice, here's an interesting question. Does Practice Builders write content for my site, or do I have to write it? And this, again, is one of the major mistakes, mistake 101 in creating the website. And I tell people when you're evaluating a web designer to help you with your website, if they ask you to write any content, find someone else. It's a real talent and a skill to write consumer digestible messaging that is optimized appropriately for the search engines and is brief and to the point, and typically written at about the 5th grade level. Again, sometimes when people hear writing at the 5th grade level, they're concerned, and then I always like to refer back to the newspapers. Newspapers in this country are written in the 5th grade level, and no one is insulted by them. To optimize my site, can I do SEO and not pay-per-click? Well, yes, you can. And again, this is where it depends on what your subspecialty is. If you're plastic surgeon or dentistry or anything like that, and you're predominantly going direct to the public, seeking a lot of clients, not as strongly on a professional referral path, you probably will need a pay-per-click strategy because your competitors will be up there. And you can just go to your computer, do a search yourself for those terms you think your patients are selecting, and see how much competition comes up. I will tell you, if your potential patients get between 15 and 20 choices on the first page, if you're not up there, you will never be selected. And you noticed how with Google, the organic or the SEO is below the maps purposely so that people have a higher visibility with PPC. Okay. So you're gonna write them for me, or?
I'll just say them out loud.
Okay. Lyra's gonna present some of the questions that we have going on.
Hi everyone. I have a question from Ronald Emerson. He's asking, what is the typical cost of PPC, or what type of budget would you recommend per month?
Yeah, you know, first off, depending on what PPC service you're going to be using or who's going to be helping with that, you may start out with a couple of $1,000s a month, which may sound very high, but then quickly refine that down to something in the $800 to the $1,000 range. It depends on how your strategy is. Every market's going to be different. Every bid price is going to be different based on the amount of competition that's in your market. And, you know, Practice Builders basically has some services that we use, that we involve for our clients, that actually have algorithms that can dial this in very quickly and kind of bring your costs down. But it's not uncommon when you're first refining this to spend a couple of $1,000s a month for a local healthcare pay-per-click strategy. I'm not talking about somebody that is competing on a national stage. That's a different type of scenario.
Okay, my second question here. Let's see. How much do you charge for website improvements?
Yeah, again, it really is a good question, but it's a difficult question to ask without seeing your website. And I don't want to cause anyone too much concern, but quite often the way that a website has been constructed, you're not really improving the website as much as you are rebuilding it almost from the ground up. If you're really going to design the backwards compatibility to be generic and organic, all the things that Google looks for, sometimes initial websites, it isn't cost effective to try and rework a site when really you're rebuilding all of that structure. So there's no simple answer to that question.
Okay, I'm sorry. I actually missed a second part of that question. They'd also like to know how much we charge for SEO.
Oh, SEO? Well, and again, this is to really understand your site, but typically our SEO services monthly after the site has been constructed properly run in the couple of $100 range to do SEO monthly. I've seen people paying $6,000 to $10,000 a year for this, depending on their specialty. So it's really one of what I think is a strong value of practice builders. But, you know, something in the mid $200 range a month, and that's constantly monitoring, updating, and working with your site real time for that value.
Okay, thanks, Jonathan. That's all the questions I have on my part.
Okay. We had one more question here, and I think maybe I've answered this already, but it says, can I do SEO and PPC at the same time? And the answer is yes, absolutely. Everyone should be working on a strong organic SEO optimization. So again, I want to thank everyone for participating. Mention a little bit about, my slide not work here, excuse me. Wanted to mention a little bit about our next webinar. And I apologize here, for some reason my slide is not moving at the moment. There we go. Our next webinar, the next webinar is going to cover everything on a high level about marketing healthcare practices. So we'll go into the 5 aspects of marketing: branding or your unique value, internal marketing, how you handle your phones, how you greet patients, patient referral marketing, recognition and reward of patients, professional referral marketing. Not everyone is on a professional referral path, but a lot of practices are. And then external marketing in depth, not just the internet, which of course is a big part of any external marketing today, and that will be on November 5th, and we'll look forward to seeing everyone there.
All right, thank you everyone again for attending our webinar. I'd like to thank everyone on behalf of Jonathan, myself, and Practice Builders for attending and taking the time to join us today. Again, we will be emailing our registrants a copy of the slides as well as a link to the recorded version of the webinar. So if you'd like to review it again or simply pass it on to another who may have missed the webinar, feel free to do so. We'll see you again soon. Thank you so much. And if you have any questions, please email myself or Jonathan at jvidal@practicebuilders.com. Thank you again. Bye-bye.